शरीरस्य च वैद्यकेन योगाकरोत्तं प्रवरं मुनीनां पतञ्जलिं प्राञ्जलिरानतोऽस्मि.
Namaste. Welcome you all for the yoga session. We are going to use a chair, a mat and a blanket. In this session we are going to focus on Parivritta Ardha Chandrasana. A very interesting standing posture which calls for flexibility, strength and stability. Before that we shall do some preliminary postures for the core muscles. Lay on your back, resting the legs on the seat of the chair. Keep an appropriate blanket below the neck. Ensure that the complete spinal muscles are properly rested on the mat. Keep both the palm on the abdominal cavity. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. While you exhale, contract the abdominal muscles little more than normal and specially sensitize even the posterior region, that is the region of the lower back and the fascia, the thoracolumbar fascia at the back. That should also respond to the breathing. Be watchful. Good breathing is very essential in all the postures. This breathing should be maintained in all other movements that you are going to practice. A good abdominal breathing also helps the mind to relax. Now relax both the arms. Keep them by the side of the trunk, palm facing down. As you inhale, rise both arms up over the head. Then as you exhale, bring it back. Match the action of the breathing. Feel the weight of the arms as you move them up and down. Inhale up. At the end of the inhalation, it should have reached the ground again over the head. Then as you exhale, bring it back, taking the palm to the side. And at the end of the exhalation, the palm should land on the mat. Match your breathing and the action. This is good for the scapular region, the shoulder joint and the arms. A good way to also improve the depth of inhalation and exhalation. Also feel the position of the arms, especially when you close the eyes. You must feel from within the position of the arms as they move up and down. That is, our ability of proprioception improves if we are able to move them as synchronously as possible. As you inhale, you must lift the arms and also ensure that as you inhale, the abdominal cavity expands. Then as you exhale, contract the abdominal muscles and also move the arms Watch the shoulder joints. Watch the scapular region. Watch the chest. Chin towards the chest. Feel your arms. Feel the weight of the arms as you move them up and down. Now relax the arms. You can fold the elbows, resting the palms on the abdomen and chest. Rise your right leg up, stretch the heel, pull the kneecap, tighten the quadriceps, the top of the thigh. Pull the kneecap, feel the hamstrings, back of the right thigh. This is a good stretch. Simple but very effective stretch for the back of the thigh, the hamstring muscles. You have to stretch the toes towards the knee. Stretch the calf muscle. Now flex the knee. Keep the right leg down. Chain. Left leg up. Pull the kneecap. Stretch the heel. Tighten the top of the thigh, the quadriceps. On pulling the kneecap. Left leg down. One more time. Right leg up. Pull the kneecap. Stretch the heel. Keep the right leg absolutely straight. Toes towards the knee. That will help the Achilles tendons to stretch, which will reinforce the stretch of the calf muscle, and this in turn intensifies the stretch at the hamstrings. Right leg down, chain, left leg. The tone of the hamstring muscles is very important even for the back to be healthy. So this movement also helps the hips and the lower back. And all this breathing is very attentively be done. Left leg down. Relax your breathing, watch your back, rise your right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the toes towards the knee. And activate the right hamstring muscles. That is, press them against the calf muscle by tightening the hamstrings so that you can feel the knee capsule. And draw the knee inline and closer to the chest. Release right leg, chain, left leg. Left leg up, fold, hold the knee, press the knee closer to the chest. Activate the left hamstring muscles so that you can feel the knee capsule. And breathe properly. As you inhale, the abdominal cavity expands. As you exhale, it contracts. This is a good movement for the gluteal minimus and medius, and also helps the lower back muscles. Release left leg. One more time, right leg up, fold, hold the knee, press the knee closer to the chest. From the hands you should pull it closer to the chest, but ensure that the hip, knee and ankle, they are all in the same plane. Release the right leg, chain, left leg up, fold, hold the knee, pull the knee closer to the chest. Breathe properly. Make the exhalation a little slower than the inhalation. Make the exhalation more profound by contracting the abdominal muscles a little more than normal. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it closer to the root of the left thigh and push the right knee. Take the heel as close to the root of the left thigh as possible and watch your breathing. As we inhale, try to feel the base of the spine, and as I exhale, contract the abdominal region. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh from left hand, push the left knee towards the chair. This is a good movement for the base of the spine, especially the sacroiliac joint. That is the joint where the hip and the spinal column meet. Even in this, tighten the hamstring muscles, back of the thigh, so that you can feel the knee capsule. Release left leg. One more time, right leg up, fold from left hand, hold the ankle joint, pull it as close to the root of the thigh as possible, then push the right knee. So these simple movements give a good tone for the core muscles, especially in the lumbar, pelvis and hip complex. So these are some very safe starters for any other movements to follow. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh and push the left knee towards the chair. Breathe consciously. Breathing is the key for the success of any posture. Get connected with the breath. Get connected with the posture. Release left leg. Watch the complete paraspinal muscles. Right leg up, fold from left hand, Hold the ankle joint, pull from right hand, push the knee across the chest. You have to pull powerfully and then push across the chest. Feel the stretch in the gluteal region, especially the gluteal maximus muscle gets a good stretch in this posture. Breathe well. Be aware of your breath. Release right leg, chain. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. The gluteal maximus muscle is one of the major muscles of our body, so this posture gives a good and intense stretch for the gluteal maximus muscles. You have to push the knee across the chest so that you get a more penetrating stretch. Release left leg. One more time. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. Feel the complete hip musculature. Feel the muscles of the lower back. To feel the muscles of the lower back or the posterior surface, you should use your breathing to sensitize that region. Release right leg, left leg. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. So this posture is also one of the very important postures for the health of the back. Release left leg. Just watch the posterior surface, the region of the lower back. Right leg fold, resting the heel on the left knee, then from left hand pull the left thigh and from right hand push the right knee. And you have to stretch the heel, both the heels, toes towards the knee. Feel the root of the or base of the right hip deep inside. You should get a good stretch. You must pull the left thigh. Now release the left thigh. Then rest the right leg also on the chair. Fold your left leg, resting the left ankle right on the knee. From right hand, pull the right thigh. From left hand, push the left knee. You have to pull the thigh so that the heel is almost at the edge of the seat of the chair, and tighten the hamstrings. Breathe well. Feel the stretch deep inside the left hip. Release right leg. Rest the left leg also on the chair. One more time. Fold right leg, resting the heel on the left knee. From left hand, pull the left thigh. From right hand, push the knee. Breathe well. So this is a good stretch for the so-called piriformis muscle, which is located deep in the hip, and the sciatica nerve passes adjacent to this. Therefore, this stretch is also very useful. Release the legs, rest the legs on top of the chair, change, fold left leg, left ankle on right knee from right hand, hold the right thigh, pull from left hand, push the left knee. Keep both heels active, toes towards the knee, and breathe well. Feel the complete region of the hip. Release right leg and rest the left leg also on the seat of the chair. Rise both legs up, fold, hold the knee, press the knee closer to the chest. Stretch the heel, toes towards the knee. Knee as close to the chest as possible. Breathe well. Here the abdominal cavity. During inhalation, feels a better massaging effect because of the pressure of the thigh, and because of the same reason the thoracolumbar fascia, the thick skin at the back, that responds better to the breathing. Just watch that region as you inhale, exhale. Also here, tighten the back of the thigh, both legs, so that you can feel the knee capsule. The outer covering of the knee also gets enhanced stretch. Or release the legs, rest them on the chair, breathing relaxed. So this in some sense is a series of postures that would help the core muscles in a gentle way, and they prepare these core muscles for further action. Slowly get up from the right side. Sit on your heel and sit upright. Sit upright on your heel in Vajrasana. Keep a blanket below the knee. Chest and navel up. Watch your breathing. We are going to do the following. Hold the chair, take your right leg forward, right knee bent at 90 degrees, chest and navel up, and then gently flex the right knee as much as possible. Press the right foot. Hold the chair so that you get a good orientation for the trunk. The pelvis should not turn. So chair helps to get a good orientation. Watch the line and length of the left leg. Take care of the orientation of the left leg. It should not sway sideways. In this posture, the right hip is in flexion, left hip is in extension. This is a very good posture for the hip flexors. One of the important movements which would help the practice of other postures. Slowly come up, right leg back, chain, left leg forward, press the left foot, then gently flex the left knee as much as possible, chest and navel up, look forward. Watch your breathing. Watch the base of the spine. It's also good for the knee. Left knee is in flexion, right knee is nearly neutral. Left foot is in dorsiflexion, right foot is in plantar flexion. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. The differential movement at the hip is very beneficial for the base of the spine. Slowly come up, take your left leg back, sit on your heel. Keep the complete spinal column well aligned. Stand up. Parivritta Ardha Chandrasana involves twisting of the trunk. So it's a good idea maybe to begin with the trunk twisting before we embark upon Parivritta Ardha Chandrasana. So sit on the chair to your right side, hold the top of the chair, inhale, exhale, turn. Turn the trunk. Grip the chair and twist the trunk. Chest and navel up. Watch your breathing. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. So all these postures, preliminary postures, make the posture, the standing posture better. We have to work with the hip flexors, with the twisting, with the hamstring, with the spine, so that the standing posture can be better, more penetrative. Slowly come up, change side. Hold the top of the chair, inhale, exhale, turn. Turn the neck also in the direction of the twist. As we inhale, the abdominal cavity should expand, and as we exhale, it should contract. Watch your spinal muscles. Twisting postures are good for both the lower back and the upper back. Slowly come up. Sit upright. Stand up. Stand closer to the chair. Watch the orientation of the chair. Move closer to the lower leg of the chair, bend forward, rest your right forearm on the seat of the chair. Watch your leg. Now slowly rise right leg up and try to twist the trunk. To begin with, you can hold the seat of the chair from left hand, but leg straight. Note that left leg is perpendicular, right leg parallel to the floor, right forearm pressed at the edge of the seat of the chair. On the front edge, you should hold the seat from the left hand. Now bring your right leg down. Then turn the chair the other way. Move closer to the front leg of the chair. Slowly bend, rest the left forearm on the edge of the seat of the chair. Twist the trunk, left leg up. From right hand, hold the seat of the chair and try to turn the trunk. Breathe well, both legs straight. Keep on pulling the kneecap. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Slowly come down. Sit on your heel in Vajrasana. Vajrasana helps the lower extremities. It's also good for the spinal muscles. Kneel down, right leg forward, bend, hold the chair, stretch the right foot to press against the lower rib of the chair. Keep the right knee flexed, chest and navel up, press the heel down and pull the heel towards you and push the left knee. This action activates the back of the right thigh, the hamstring muscles. Ensure in the beginning to keep the knee slightly flexed, then gently straighten the right leg. Extend the knee completely, pull the kneecap, straighten the quadriceps, chest and navel up. So this will ensure a good stretch for the Achilles tendon, the calf muscle as well as the hamstring muscles, the back of the thigh. For that you have to raise the chest and navel up. So this is where the chair helps you further. It gives a good support for you to push the right thigh down and lift the navel and trunk up. Slowly take right leg back, chain. Left leg forward, foot against the lower rib of the chair, left knee slightly bent to begin with. Press the left heel and pull towards the right knee so that the back of the thigh becomes active. Chest and navel up. Then gradually extend the left knee, pull the kneecap, stretch the heel, push the root of the left thigh down, lift the trunk and navel up. It's a very useful posture to tone the back of the thigh, the hamstring muscles. One of the very large muscles group that we have, and it has a very high degree of participation in many postures. Slowly take the left leg back, sit upright on your heel. Ideally, heel should be together and hips should sit on the heel. Watch your breathing. In all these postures, it's important to go step by step so that you can get the alignment properly and you can penetrate into the posture properly. Stand up. Sit to a side so that you can turn to your right side. Hold the top of the chair. Inhale, exhale, twist the trunk. Hold the top of the chair and turn as much as possible. Breathe well. With every inhalation, stretch the trunk up. With every exhalation, twist the trunk more. Keep the elbows closer to the trunk. Both the shoulders even. Turn the neck also in the direction of the twist. The twisting is also useful for the intestinal organs, the pelvic organs. Watch your breathing. Slowly come up and change side. Hold the top of the chair. Inhale, exhale, turn. And when you watch the posture, when you watch the breathing, and you get completely involved, the mind automatically gets into that framework of focus. And this is also important in calming the mind, which is one of the main benefits of yoga. But get involved, go deeper into the posture. This is where supports like chair, etc., they play a long role. They help you to get the posture properly. They also help you to stay longer so that you have sufficient time to penetrate into the posture. Slowly come up. Sit upright. Stand up. Keep the chair and stand on the left side. Stand closer to the front leg of the chair. Bend, rest the right forearm on the rear end of the seat. Rise your right leg from left hand. Hold the top of the chair and twist the trunk. Turn the shoulder so that the trunk twist can be better. Both legs straight. Breathe well. Parivritta Ardha Chandrasana. Gives you good balance, good stability, good flexibility. Slowly bring right leg down. come up. Change side, change the direction of the chair, stand closer to the front leg of the chair. Bend forward, rest the left forearm on the rear end of the chair from right hand, hold the top of the chair, raise your left leg, turn the right shoulder. Trunk and left leg parallel to the ground, right leg perpendicular to the ground. Hold the top of the chair and turn. Twist the trunk, stretch the trunk. Both legs straight. It's good for the lower extremities, good for the hip, pelvis and abdomen. Feel the alignment. Slowly bring the left leg down, slowly come up. Sit upright in Vajrasana. Chest and navel up. Stand up. Sit on the chair. Sit to your right side. Press the foot properly. Chest and navel up. Hold the top of the chair. Inhale, exhale. Turn to your right side. Grip the chair and turn. Keep the shoulders even. Turn the neck also in the direction of the twist. With every inhalation, you should stretch the trunk. With every exhalation, you should twist the trunk. And then watch your breathing. As we inhale, the abdominal cavity should expand, and as we exhale, it should contract. Do not hold the breath. Twisting postures help relieving the stress in the lower back, also helps the intestinal organs. Slowly come up, change side, sit to your left side. Sit upright. Hold the top of the chair, inhale, exhale, turn. Use the grip. Use your forearm and upper arm to induce a good stretch for the rotators of the trunk. The oblique muscles of the abdominal region also stand to benefit from twisting, and proper breathing ensures good massaging effect on the intestinal and pelvic muscles and organs. Slowly come up. Sit upright. Stand up. Sit on your heel. Parivritta Ardha Chandrasana gives a good degree of suppleness to the trunk. That is the reason why we introduce some intermediate postures. Sit to a side on the chair, sit upright, hold the top of the chair, inhale, exhale, twist the trunk. And from right hand hold the seat of the chair so that you can open the right shoulder further. So complete top of the chest gets a further stretch. Grip the chair properly, turn. There's also a good way to mobilize the shoulder joints and the scapulae. Turn the neck in the direction of the twist. Watch your breathing. Slowly come up, change side. Sit to your left side, hold the top of the chair, inhale, exhale, turn. From left hand, hold the seat of the chair and further twist. Roll the left shoulder back. As we inhale, abdominal cavity should expand. As we exhale, it should contract. This is also an helpful movement in executing Parivritta Ardha Chandrasana. Slowly come up, sit upright. Stand up for Parivritta Ardha Chandrasana. Note the positioning of the chair. Stand to the side, stand closer to the front leg of the chair. Stand upright, bend forward, rest the right forearm on the rear end of the seat of the chair. Raise your right leg up. Now left hand on the waistline. Twist the trunk. Both legs straight. Twist the trunk completely. Exhale deeply. Create space, create freedom in the abdominal pelvic cavities and turn better. Stabilize. Parivritta Ardha Chandrasana. Roll the left shoulder back. Slowly bring the right leg down. Slowly come up. Change the orientation of the chair. Stand closer to the front leg of the chair. Stand upright. Bend forward. Rest the left forearm on the rear end of the chair. Rise your left leg up, right hand on the waistline. Twist the trunk. Turn the neck also and look up. Roll the right shoulder back. Both legs straight. Trunk and the left leg parallel to the ground. Right leg perpendicular to the ground. Be aware. Be watchful. Watch your trunk. A nice twisting. Watch the pelvis and abdominal cavity. And breathe well. Slowly bring the left leg down. Slowly come up. Sit upright on your heel in Vajrasana. Both the beginners and the advanced practitioners can make use of the chair to feel the posture properly, to understand the alignment properly, to stay for a longer time so that you can penetrate deeper into the posture, which has a lot of psychological advantage. Chest and navel up. Line your chest, keeping the chair in front. Rest the wrist on the edge of the seat. Press the palm on the seat of the chair. Both arms straight. Relax the neck. Stretch the toes back. Tighten the calf muscle. This is a good stretch for the shoulder joint and also the upper chest. Neck also stands to benefit. Be strong on both the arms. Tighten the muscles of the upper arm and forearm. Press the palm. Middle fingers pointing forward. Relax the neck. And if possible, rest the forehead on the mat. Flex both arms and relax. Press the palm. Slowly get up. This gives a very good stretch for the arms, the scapulae, as well as the upper chest. Sit upright in Vajrasana. Watch your breathing. Slowly get up. Sit your right side on the chair, chest and navel up. Hold the top of the chair, inhale, exhale, turn. And from right hand, hold the seat of the chair to further twist the trunk and also give better opening to the right shoulder and the upper chest cavity. Turn the neck and watch your breathing. Keep the tongue relaxed. Twisting postures help a lot to invigorate the intestinal organs. Slowly come up and chain. Sit your left side, hold the top of the chair, inhale, exhale. Turn. From left hand, hold the seat of the chair and further twist. Move the left shoulder back. Chest and navel up. get involved in the posture. Have complete musculoskeletal awareness. Slowly come up, sit upright, stand up. We shall do Parivritta Ardha Chandrasana again. Your arms are also well stretched. Feel that. Note the orientation of the chair. Stand close to the front leg of the chair. Bend forward. Right forearm on the rear end of the seat. Raise your left leg. Right hand pressed. Left hand on waistline. Then stretch your left hand up. Look up at your left palm. Stretch the left arm. Tighten the muscles of the upper arm, forearm. Both legs straight. Stretch the trunk, twist the trunk. Slowly bring the right leg down. Come up. Change the orientation of the chair. Then stand closer to the front leg of the chair. Stand upright. Bend forward. Left forearm on the rear end of the seat. Raise your left leg up. Right hand on the waistline. Twist the trunk. Then raise your right hand up. Turn the neck. Look up at your right palm. Both legs straight. Feel the breath. You have to stretch this trunk and also twist. Stabilize on your right leg. And also ensure that you breathe slower and steadier. Slowly bring the left leg down. Slowly come up. Stand upright. Sit upright on the chair. Chest and navel up. Palm should face upwards. Tip of the thumb and index finger in contact. Relax your tongue, nose, throat and the jaws. Just watch your breathing. Just pay attention to the breathing. You don't need to control the breath. You must learn to be a witness to the process of inhalation and exhalation. Just watch. The air comes in through the nostrils. See which nostril is dominant, or is it even through both the nostrils. Then what happens at the abdominal cavity? Normally, as we inhale, the abdominal cavity should gently expand. As we exhale, it should gently contract. Just watch. Be with the breath. This is one of the simplest techniques of meditation. To simply be a witness to the process of inhalation and exhalation. And that can go a long way in inducing a deep calmness. Namaste.
योगेन चित्तस्य पदेन वाचा मलं शरीरस्य च